So nice to have all our audience here today to join us. My name is John Radigan. I am the Cultural Affairs Officer at the U.S. Consulate in Karachi. I'm newly arrived here and I'm so excited to be here. I have one of the best jobs in the consulate because I get to work on areas related to cultural programs, cultural exchange, and educational engagement, particularly the higher education engagement. And we have a really great story to tell when it comes to academic cooperation between the United States and Pakistan, including in addressing the effects of COVID-19. Tonight's COVID speaker series is a great example of that, and in particular because it addresses our parallel pandemic project. So tonight we're going to hear a little bit more about this collaboration. And to start us off, I'm really pleased that we have with us tonight our Minister Counselor for Public Affairs from the U.S. Mission to Pakistan, Ray Castillo. Ray, thank you so much for joining us this evening. Would you like to start us off with some opening remarks?
Why, yes, I would. Thank you so much, John. Bahut shukriya, John, and assalamu alaikum, and good evening, everyone. So my name is Ray Castillo, and I'm the Minister Counselor for Public Affairs at the U.S. Mission in Pakistan. And it is my great honor to be here with distinguished scholars from both the University of Karachi and from George Mason University in the state of Virginia. And those educational institutions across Pakistan, and all of you who are going to participate by hearing the results tonight, we welcome you to the 8th and penultimate installment of the U.S. Mission Pakistan COVID Speaker Series. The final one will be on March 2nd, and we hope that everyone here will be able to join us again. So it was a little over a year ago, on February 6, 2020, that the first known U.S. victim of the COVID-19 virus passed away. And since then, life in the United States has changed dramatically. That has also been in the case in Pakistan and worldwide. And the United States is committed to working with allies and partners to combat COVID-19. And we have been doing so from the start. When COVID-19 struck in Pakistan around the same time, February 2020, the embassy met with the government to partner on priority areas to support the government's response to the pandemic. We worked with our Pakistani partners to improve viral testing, treatments, monitoring in hotspots around the country by providing mobile test laboratories. We collaborated with the National Disaster Management Authority to save thousands of lives through the donation of 200 brand new state-of-the-art American-made ventilators. We partnered with the Higher Education Commission and more than 30 universities in Pakistan to improve the access and quality of education through viral online trainings for educators. And just as we see tonight, I'm sure many of us have been on virtual meetings or virtual classes all day long. In July 2020, we launched this particular exercise, the COVID Speaker Series, to bring industry experts to discuss best practices and help Pakistan adapt and thrive during the pandemic in partnership with some prestigious universities across Pakistan. And the United States partnership with Pakistan is one of substance, and it demonstrates our shared interest in a safe, secure, and prosperous Pakistan and world. Fostering collaborations between Pakistani and American universities is one way in which we grow and strengthen our partnership. Over the past decade, university partnerships have yielded faculty development, new curricula in both Pakistan and the United States, and improved access to and quality of education in both our nations. These partnerships, the tremendous results that we see from them, do not happen overnight. From 2013 to 2016, Karachi University and George Mason University established a joint research and faculty exchange on public administration. Vice-Chancellor Iraqi, who will speak in just a moment, was actually the project coordinator for the Karachi side of the partnership. And then this is before he became Vice Chancellor. Today, the research group, they're going to discuss one of the most successful projects to emerge from our partnerships to date, the Parallel Pandemic Project, which produced joint research on the parallel effects of COVID-19 in Pakistan and the United States across many sectors. I know you're looking forward to their discussion tonight, as am I. This pandemic has affected everyone on the planet in some way, and I'm curious to learn about the similarities and the differences that COVID-19 has produced in our two nations. So on behalf of the mission to Pakistan, I want to thank the scientists and faculty for presenting tonight. And I want to thank you all for attending this evening. Shukriya. Back to you, John.
Thank you so much, Ray. Well, before we get started, I'd like to introduce our distinguished panelists who are here with us this evening. The first person who we'll be hearing from is Dr. James Witte. Dr. Witte is a professor in the Department of Sociology and Anthropology and director of the Institute for Immigration Research at George Mason. He earned his PhD from Harvard University and has been a professor at Clemson University and Northwestern University. Since coming to George Mason in 2009, his major projects have included the privately funded Institute for Immigration Research, the National Science Foundation funded Digital Archive Project, and he served as the co-principal investigator for the university partnership with the University of Karachi, funded by the US State Department. The second person who will be speaking tonight is Dr. Tehmina Faisal. She is an assistant professor with the Department of Public Administration, University of Karachi. She was associated with the GMU and UK and the University of Karachi Parallel Pandemic Project as the lead participant and coordinator. Currently, she is associated with multiple research projects focused on social policy, sustainable development, youth engagement, women's empowerment, and encouraging entrepreneurship. She will speak about education. We also have with us Nishit Sahay, who is a senior advisor on external relations at the Institute for Immigration Research at George Mason. He earned his master's in experimental nuclear physics from the Center for Advanced Research in Physics and Astrophysics in Delhi University. He has his MBA in international business from IIFT, and he also has a master's in transport policy and operations and logistics from George Mason University, with which he's been associated for 20 years. And he will be speaking on legislative responses to COVID-19. And then the fourth panelist that we have with us tonight is Dr. Mustafa Hyder, who is a research scholar and faculty member at the Department of Public Administration, University of Karachi. He's formerly a corporate trainer and career counselor, and he graduated with a degree in computer science from the University of Karachi in 2001 and worked for Faizaya Degree College as a lecturer for 7.5 years. He then shifted from physical sciences to social sciences and did his master's in public administration at the Department of Public Administration at University of Karachi. He was a participant in the George Mason University and Karachi University partnership. So I want to thank all our panelists for being with us this evening. And I would also like to mention that we are very proud to have with us tonight Dr. Mark Ginsberg, the Provost and Executive Vice President of George Mason University, as well as Professor Dr. Khalid Iraqi, the Vice-Chancellor for the University of Karachi. And I'd like to invite now Dr. Iraqi, if he would like to give a few words. Thank you, Doctor.
Thank you. Good evening, good morning to everyone. I think as a Vice Chancellor, University of Karachi, it is very heartening to note that the Department of Public Administration and the School of Policy and Government and the Institute of Immigration, George Mason University, we are having another partnership in terms of parallel pandemic project. I think this pandemic has provided us an opportunity to contribute for the society. And the theme of the project is how societies and the different culture responded to this COVID. It's a very interesting reading. And I hope the research will provide understanding to the people that how we responded and how we took the responsibilities. I think this pandemic has overall affected different subjects, but particularly, I believe it is about health and education sector, the most important social sector, that is health and education. I have seen the agenda of this project as well, and I must appreciate James Witte and my faculty from public administration to covering the different aspects whether it's about economy, health, social issues. So I hope this deliberation will provide an opportunity for everyone to have an understanding of the policy responses and how we implemented and executed policies and what challenges we are facing in future. As mentioned by one of the speakers about University of Karachi and the George Mason University Partnership Program, I think it was a very successful project in terms of encouraging our research scholars and to provide people-to-people contact. And I think it has strengthened the relationship between different universities and particularly George Mason University. I am a product of this university partnership program as well. It provided me an opportunity to learn about the leadership qualities. And I must appreciate, and we must remember Professor Roger Stout. He was instrumental in terms of university partnership program between public administration and the George Mason University. And I must appreciate James Witte as well, that whenever we talk about university partnership program, there was one element that is about sustainability, how we are going to continue this project. And I think US government and US department has provided this opportunity to bring together these universities together. And I see a bright future and a much longer relationship between the University of Karachi and other universities of United States of America. I hope that we should carry on this spirit of collaboration in terms of research, in terms of sharing of knowledge. So I must appreciate the government of United States of America, the US Department, and particularly my friend James Witte for engaging us in such a productive project. Thank you.
Thank you so much, Dr. Iraqi. Now I'd like to ask Dr. Witte if he would like to say a few introductory words and then introduce Dr. Ginsberg.
Yes, thank you, John. It's a pleasure to be here this evening, this morning, and to see people I've been working together with for a long time. And I'd like to echo Dr. Iraqi's sentiments and thank the US State Department, particularly the consulate in Karachi, for all of their support for the Parallel Pandemic Project, and prior to that for the university partnership. I think we've built a good, strong relationship, learned a lot from each other, and I think had a good time doing it, which is always fun and makes the work all that much more valuable. I'd right now like to introduce Provost Ginsberg from George Mason University, who's joining us to make a few opening remarks. But I will say, one of the things that I've really been struck during the pandemic is the importance of higher education leadership. And I think we have two excellent examples of that kind of leadership here on this Zoom call, Dr. Iraqi and Provost Ginsberg. And, I think this is, running a large university is never easy. But I think in this time and the special challenges that are being faced due to the coronavirus really has brought out the best in both of these leaders. And I appreciate that they can both spend some of their valuable time with us today. So Mark, would you like to say a few opening remarks?
Yeah, thanks, Dr. Witte. Jim, it's great to be with the group, and thank you so much for inviting me. And Dr. Iraqi, very good to see you as well this morning. And thank you so much, by the way, for mentioning our former colleague, Roger Stout, who we remember with great fondness. As you know, Dr. Stout passed away several years ago, but was one of the people at our university who worked so hard and so closely with colleagues in Pakistan. So thank you so much for recognizing Roger this morning. I also want to thank the consulate, United States Consulate in Karachi, for your support of this project and for helping to be the catalyst to provide the opportunity for this project to take place. The relationships between George Mason University and University of Karachi are long and deep, but certainly the support and the facilitation of the consulate in helping to further extend those relationships. And this particular project, we are very appreciative for. You know, partnerships are very important, but partnerships are most important when they're collaborative. And this project, as I've experienced it, and some of you may know that as the project took place, I participated in it as one of the speakers and one of the participants in the project itself. The Parallel Pandemic Project is not just a partnership, it's a collaboration. And it's of high value. I think both those of us at George Mason and I know our colleagues in Karachi value the work that's been undertaken, value the information that's been exchanged, and value the relationships that have been extended and new ones that have been made. Exchanges are as important as collaboration. And my experience and most of my work on personal research and scholarship over the last 2 decades has been both within but also outside of the United States. And what I find repeatedly, and what I found also certainly with this project, is that although we impart information, we gather and learn more than we impart. And so the relationships, the network, the exchange, and the opportunity to learn from each other is paramount. And this project, I think, is a terrific example of how we do that. Again, a collaboration more so than a partnership. My experience working with universities in Pakistan has been just stellar, both with the University of Karachi and several of the universities that I've had the great fortune and honor to work with. And the connections that we make, again, the relationships that we establish at a time when the pandemic has taught us many lessons. One of the lessons of the pandemic is that we are one world, and that if we are not able to work in a way that is in harmony and in balance and in collaboration with each other, we will frankly never recover from the pandemic, but moreover, we will be much better served in so many different ways as we continue to do this. And so I want to thank those who've been involved in the Parallel Pandemic Project, Dr. Witte at George Mason, certainly, and our colleagues from Karachi for helping to create and manage and lead a project that is consequential, of high impact, and I know will lead to continued partnerships and collaborations on many important issues and many areas of common interest. So again, thank you so very much. It's a pleasure to be with you this morning. I wish you well, and I know the conversations that will take place shortly will be both inspiring and certainly very informative. Thanks again.
Thank you so much. Oh, sorry. Dr. Witte, back to you.
Yes, what I'd like to do now is talk a little bit more about the Parallel Pandemic Project. You've gotten a little bit of an overview. I'd like to go into some greater detail and talk in particular about the origins of the PPP, its aims, how we've structured it, and then we'll go into discussion of 4 thematic sessions that we held over the summer. One on COVID-19 and the healthcare systems, which Nishit Sahay will provide. And then Dr. Tehmina Faisal will speak about COVID-19 and education. I'm going to come back and talk a little bit about policy implementation. And then Dr. Mustafa Hyder will talk about COVID-19 and religion. And in each case, we're going to give a little bit overview of how these 2 aspects of social life are organized in these 2 very different societies, and then a little bit about the impact of COVID-19, and then some of the similarities and differences in each of these areas, as well as some takeaway points. But I think to come back to the aim of the Parallel Pandemic Project, I think what we have to, and the way we have been thinking about this, is it really is an exercise in social science. And its origins began, as John Radigan mentioned, with the university partnership between the University of Karachi and George Mason University beginning in 2013. This was a really, the State Department has set up, I believe, a total of 26, perhaps, of these partnerships, focused primarily on the social sciences and the humanities. And our partnership really was built on the relationship between departments of public administration at the two universities. And really what we focused on here during that partnership program was three aspects: curriculum development. And the project was built, the partnership was focused on a theme of managing megacities. And so what happens to the issues of public administration when you take it to a scale that you find in a megacity, 10 million residents or more. And so trying to figure out how to build that into the curriculum was one part of the university partnership. A second piece was capacity building. And really developing knowledge for us from the United States about Pakistani society, and then also for our Pakistani colleagues in methods of social science research. And we began the partnership with a visit by 7 of our colleagues from the University of Karachi, including Dr. Iraqi, and really worked on sort of the basic methods and tools of social science research. And here I'll just mention 2 outcomes that I think are particularly important. First of all, as Dr. Iraqi mentioned, he was a participant and is now a vice-chancellor. 2 additional of our original 7 participants are now vice-chancellors at Pakistani universities. And we're very proud of that. In part, we think we contributed to the success of these scholars, but also I think we picked the right people, that we got the right participants in the program, and this really was an opportunity for us to see them develop and for them to help us. And then one of the very concrete outcomes, and was a focal point of the original partnership, is that learning how to do methods and research is an abstract thing, and you really need to put it to use in a concrete setting. And toward that end, we did a really unique survey of 2,000 households in Karachi. And it was a chance for all of us, the US participants, as well as those from the University of Karachi, to see firsthand how you implement a social science research project in a setting that's a little bit different. Okay, and trying to think about approaches to sampling and data collection, as well as the normal issues of survey development and deployment, and then the data analysis, all of which culminated in 2016 with a very successful conference that was held at the University of Karachi, where we had well over 300 participants. It was incredibly well organized by the administration of the University of Karachi, and really brought scholars together from around the world to talk about issues of managing megacities. And the PPP itself, we've had ongoing collaboration between the University of Karachi and Mason since 2016, where I've served on a couple of dissertation committees. We worked together on joint grant proposals. In August of 2019, I went with a delegation of US business folks led by representatives of what was then called PABA, the Pakistan American Business Association, which is now the US-Pakistan International Chamber of Commerce. And again, Dr. Iraqi went to great lengths to introduce us to individuals who were interested in growing trade between the United States and Pakistan, and really our emphasis on this, and this is an ongoing effort to bring the two countries together for mutual benefits, is really trust through trade and thinking about economics as a way to build a bridge between two societies that should be closer together and need to become closer together in the future. The aim of the PPP, we'll introduce and we'll talk more about this, is the comparative framework, so that you can see what we imagine and what was a external exogenous shock to different societies. It plays itself out in different ways based on the institutions and culture of those societies. And so to be able to isolate the impact of cultural and institutional frameworks, having variation, such as we find between the US and Pakistan, is essential. This is where we can see the importance of institutions and culture. Secondly, we really did see it as an exercise in people-to-people diplomacy. Over the summer, we met 9 times and brought together faculty and graduate students from both universities for a couple of hours, had a sort of learning about the institutions and organized around different themes. But it was also a real opportunity. We use Zoom breakout rooms to have people from Pakistan who have never been to the United States and people from the United States who've never been to Pakistan to talk about the shared lived experience of COVID-19. And this to us was really sort of data and a way to think about, as we move forward with the PPP, how we understand how human beings, not just institutions and culture, but individuals have experienced COVID-19. And the other piece that was important is that we saw it as kind of a communal space. That I think it's easy for us, we're sort of now adjusted to COVID-19, I think, in our own weird ways, that we wear our masks, that we go to Zoom meetings, and we talk about a future where hopefully sooner or later, vaccines will be widely globally distributed, and we can begin to put away the Zoom backgrounds and begin to meet in physical spaces, whether it's in the United States, in Pakistan, or traveling back and forth to each other's countries. But in the summer, that wasn't the case. There was much more uncertainty, I think. And this was particularly at universities, where classrooms were closed, where the sort of structure of day-to-day interaction was missing. And we really found that the students and faculty who came to our weekly sessions over the summer enjoyed them and enjoyed the human contact that they were getting through these sessions. And Mustafa Hyder and I would be in the main room, and we'd put people in breakout rooms. And it was always interesting when the breakout rooms ended, how many of the participants came back smiling and laughing. Because they really had had a chance to connect with one another and talk about some of the similarities and differences in their respective home countries. So those were sort of the aims, the structure of the PPP. What we're going to talk mostly about today is what we're calling phase 1. And those were those weekly sessions where we looked at a variety of themes. 4 of them we're going to talk about today, and then 4 of them at a later presentation, each sort of picking out an aspect of social life. So we began, of course, with healthcare, and gave an overview to the Pakistani participants of what the healthcare system or non-system looks like in the United States. We had different invited speakers to talk about that topic from the US side, and then the same thing from the Pakistani side. And then we would, each week we switched out whether the Pakistan side came first or the US side. And then what we did is each of the speakers also talked a little bit about the impact of COVID-19 on that particular institutional sector of society. And then we had our breakout rooms and came back and sort of listened to what people had discussed and what they observed about their lives during COVID-19. And so this was phase 1. And I can't thank the State Department, the US Consulate in Karachi, for then supporting us in providing some really sort of key funding for what we're calling phase 2. And there, what we've done is, again, with the support of the consulate, we identified 10 Pakistani students and junior faculty who had been participants, and 10 on the US side. I think about 6 of the US participants are from George Mason and 4 from other universities. And we assembled them into project teams, each led by one or more faculty member from Pakistan and from the US. And really then we're going to build on, and this is in progress right now, phase 2, that we're going to build on our shared experience and develop research proposals that would go forward in different aspects that seem so important, and where we'll be looking for, again, sustainability is important, that we'll be going to some international organizations, private foundations, and other sources to learn more about these different areas and what COVID-19 has taught us, the lessons that we should be learning for future crises. And we've already got, I think, well, we've got 5 good teams already in place. One of them's looking at economic restructuring and its impact on supply chains and the labor market. We have one on migration and remittances. We've got a 3rd group working on the critical issue of food insecurity and how that has been addressed in the pandemic. And again, always thinking about what we can learn for the future. And then 2 other groups, one working on religion and on the impact of the media in the 2 countries. So what I want to do now is I'm going to turn it over. We're going to go through 4 of the areas and discuss what we learned in phase 1 in each of these areas, and then go on and talk about some of the takeaways and things that we're thinking through for future research. First, we're going to have Nishit Sahay talk about healthcare systems. Tehmina Faisal will talk about education. I'll talk a little bit about policy, and then Mustafa Hyder will touch on religion and the way religious institutions in the 2 countries, 2 societies, sort of fit into COVID-19 and in some ways mitigated and in some cases exacerbated the impact of COVID-19. So I'm going to hand this off to Nishit right now and have Nishit speak about COVID-19 and healthcare systems. The most common phrase, unmute yourself, for 2020. Go ahead.
Yeah, can you hear me now? Yeah, good evening and good morning to everyone, to all our colleagues and friends in Pakistan and in the United States. First of all, I really thank Dr. Iraqi for mentioning Dr. Roger Stow's name. He's very dear to us, and I've worked with Roger for more than 20 years. And today I'm using Roger's laptop. Anyway, so we had a very extensive and very in-depth study on how the people between the United States and Pakistan, how they deal with the various measures that the respective government took during the lockdown period, from the month of February to July, because this healthcare session was held on 8th of July. So we had 2 very distinguished speakers, very expert in healthcare industry. One, Dr. Abdul Bari Khan from Pakistan, and Dr. Dennis McBride from USA. Dr. Abdul Bari Khan is one of the most distinguished doctor, I would say, who really worked from scratch and set up I think several hospitals in Pakistan. He provided in details how the healthcare system in Pakistan operates, and Dennis McBride provided the similar expressions and evolvement of United States healthcare, which is over 200 years old, and where it is now, and how did the people felt about their deliverance. According to Dr. Khan, I think the Pakistan has three different layers of healthcare industry. One is public sector, other is the private sector, and the third is the philanthropic group. They all manage, but unfortunately, none of them are properly regulated, and the people felt not very comfortable the way government tried to impose the various measures to control the spreading of coronavirus, government's point of view was between the life and livelihood. They did whatever they felt good, but somehow the people there in Pakistan, for various reasons, Pakistan is very religious country, so they follow many rules and regulations that this religious cleric, who whatever they ask them to do, they felt that keeping a distance or closing down many of the economic activities is really harming them, because Pakistan is also in terms of its GDP, it's very low, and economically it was already suffering, and this lockdown has really put the people into a very hard space. So somehow people were not very happy, and they felt that the government should have done little more than what they really experienced. And Dr. McBride explained the US healthcare, and he said that it is two complex competing industry which is operating in America, and they all have got their own interest, and in between the people have to pay the price for that. And US government did try to control the virus, whatever the way the possible, but somehow this complex competing industry, the private sector and the public sector, and the third force that he mentioned was the media. Media also played the role, which for some people it was helpful, but for the majority of the Americans, those who were very hard hit by this lockdown, they felt that they didn't do good work. But what are the similarity between the United States and Pakistan, despite being very two different countries in terms of its socioeconomic and the political conditions, cultural background, ethnic background, that they both felt that the way the measures the government took to control the spread of virus was not very favorable. They should have done little more. So, and the lesson learned from this interaction was that there has to be more interaction between the various stakeholders in the healthcare industries, and they should give a serious thought to take the people's interest into consideration first, and or anything where the business comes. So this was the take for the health industries in the United States and in Pakistan. Thank you.
Very good. Thank you, Nishit. I think now we're going to turn to Dr. Faisal, who is going to speak on education and COVID-19. Tehmina?
Yeah, I'm there.
All right. The floor is yours. The virtual.
So I hope I'm audible.
Yes, you are.
Yes.
Yeah, I hope I'm audible. So those sessions we were talking about, as Dr. Jim pointed out during the beginning of the meeting today, or in the webinar today, these sessions are very close to our hearts, for the fact that when we're doing nothing, sitting home, trying to figure out how to go about our connecting with people, how to somehow express ourselves and find narratives that actually be more purposeful, more meaningful to us, and somehow put us at ease that we are going through a situation that is somehow similar for everybody. And this particular project just popped up as an informal initiative taken by Dr. Witte and Mustafa, and just everyone sort of said, okay, fine, this is going great. And all of the themes that we selected, out of all of the themes that we selected, this particular theme for education was very close to our daily life also, and was very relatable also, for the fact that we're all research scholars related to the field of education and academics, and we had certain narratives and certain expressions that we could add to somehow evaluate the situation at hand. And we had so many people there in the session. Most of the times I might be quoting a few people in my session meeting time also, but all of them had serious concerns for education, regardless whether they were staying in Pakistan or they belong to US. The situation of US was discussed by the Provost GMU, Dr. Mark Ginsberg, and he gave a very broad narrative, starting from the school point of view, how primary level education and how children are facing difficulties, how that is somehow helping them, not actually helping, but somehow being a challenge for them. COVID is becoming a challenge for small kids, and it is very difficult to them, for all of us, to explain to our kids why do we want to keep them at home? Why can't they meet their friends? Why can't they go to school and meet their favorite teachers? And so all of this was very nicely discussed with him in a very comprehensive presentation, I remember. And I was going through his presentation, so he also pointed out the US philosophy for education and learning is more based on critical thinking and purposive learning and creative learning, and it's more of an interactive education system and more of an interactive, more activity-based learning system. And that was why the crisis for the pandemic was more felt, because of the fact that the education system requires a more interaction at the physical level, also an on-site interaction, where students would have to go to school or maybe to their colleges and universities to acquire knowledge, but not just knowledge, but somehow acquire a practical exposure to whatever they expect to learn. And because of that, the education system genuinely suffered in the beginning. And all, I would be discussing the challenges also. So that was the main take that was given by the provost initially. And from the education side, I had the opportunity to add in a few words to the whole presentation the whole time. And I was, for Pakistan, it was very different for us. Generally, we are a tough nation, and we usually take such crisis as a very small aspect, 2 or 3 days of mourning or 2 or 3 days of feeling bad, but then we bounce back to our usual self. So this particular pandemic was causing such forms of uncertainty that even smaller kids and even the younger kids and even the senior scholars also, they were also at they were unable to understand how to actually respond and how to actually come up with ways to connect to people. And we all realize that education is not it is not just learning. It is not just passing your class and acquiring the right grades, A grade, B grade, C grade. It is more, when we talk about education, we somehow intend to acquire certain social skills. We intend to go for networking. We intend to go for certain practical skills. We would like to, it's a whole package. And that is why, when that is what we expect out of from a school or from a college or a university. The best of the universities are those that are enabling students, rather than filling them up with knowledge and not empowering them to somehow explore their own potential. So for us here in Pakistan also, it was a very challenging situation, and the provost, he identified some very critical areas of concern for the education sector that were pretty similar to what we experienced here in Pakistan also. I've been, as a mother, I have 2 kids, so as a mother, I am also connected to other mothers and a lot of school activity. And I was also following a lot of social media, interactive blogs and sites, and Facebook pages and all. And I could see how parents are concerned about their children, how they will connect to their teachers, how will they able to learn. See, it was, and especially for the fact that there was an uncertainty at the end of the tunnel. You just did not know what is happening and when will this end. So for us, it is, I think it was very, very uncertain situation where we would really like to see our kids in school and having fun. But unfortunately, they had to somehow stay home. And we had, as parents, had a bigger role to play in their upbringing and in educating them, in keeping them engaged. And that also somehow created a little frustration also. So for the Pakistani part, I just told you, that is more of a knowledge-based study. It is more of even the learning outcomes are more theoretical based, because our learning system or the education system is based more on engaging students in conceptualization and creating theoretical frameworks. And eventually, we hope that this particular foundation would help them in their when they make professional choices. And therefore, the challenges that we faced, the challenges that were identified in the session, in the PPP session, were regardless of the different philosophies, were pretty similar. And the first challenge that overall we faced is naturally the use of technology and remote learning. A lot of for one thing, the smaller aged students, or the children, the smaller stage children, especially those that were going to kindergarten and were going to primary school till grade 5, were genuinely facing an issue with how to handle technology. Also, there were many parents who were unable to somehow connect to the school activities through technological interventions. And I think we can all relate to this particular problem at hand, because somehow all of us, whether at work or whether at home, or whether in schools or colleges, we somehow all were unable to connect to the whole use of technology more efficiently and more effectively. And then again, like I said, school is not just education, or school is not just one form of learning. It is an experience, and you just don't get that experience with technology. You feel far off, like I do right now. I cannot see any one of you, but yes, we are conducting a webinar right now. So it's somehow a very different kind of experience that we just, it's hard to explain to the smaller kids, and also the parents who were unable to connect. And this also caused one form of frustration among the teachers and the parents, because as we all realize that teachers, parents, and the students, they all have a very significant role in the development of a child. Or this particular role was pretty much suffering in the few beginning months of COVID-19, where the whole of the world was struggling with finding solutions, more effective and efficient solutions, to ensure a more coordinated, collaborated, a more purposive solution to dissemination of education overall. Then there was the different learning styles that were adopted. Those were also adopted on an experimental basis. And so initially, in our countries, people experimented, both in the US, the challenges that we faced initially were related to the school managements and the university managements tried remote learning. They tried online learning. They tried giving away assignments and trying to give the students some time to research and study. And they just tried to empower students more, and they had to, because there was no other way for online learning, and if you're connecting through technology only. So yes, this is how people took and adopted different learning styles. And I think this was one of the takeaway also that I would be covering later also, that this pandemic forced and pushed us into a direction where we could actually explore new innovative ideas and more comprehensive solutions for education. Because we all realize that education has been a debate. Innovative education and more relevant education has been a debate since pretty long. And academicians and researchers, they are, and even the organizational experts, they anticipate that the kind of skill set that we require a few decades down the lane is still not certain, and it is still not available. So yeah, we do have to work. We did have to explore new ways of teaching, new disciplines, and this pandemic actually pushed us to that direction, where we realized that we have no other way but to explore newer options, and we just had to just let go of the conventional education and learning systems. Then a very, very soft point for all of us was the trauma for the suffering learning for the special needs people. And the special needs education is a very sensitive topic. It has to be dealt very humanely, and the children there are more focused not on education but more on human interaction, more towards attention, more towards kindness, more they just are taught more of ethical values, more of the life skills. So for them, and also their interaction and their interaction on campus in during school hours or college hours is critically important for their growth, for their mental health. So this was a very critical point of concern for both the nations, where it is almost impossible to conduct or help them learn or connect to the special needs people through online sessions and try to make them understand what they are expected to do or how they should respond. And that is why it still stands as a huge challenge for all of us. How will we actually help them connect to the community at large in these times? And naturally, there was a very serious concern with those students who are opting for preparatory classes, who are opting for career counseling, who are opting for their next big thing in life, that is they were just about to make their professional choices. Those students who are going for university admissions, all of them were, and then they had the grades system at the 12th grade. So all of those students were also very uncertain as to how will they be graded, how will the university react to these grades that they are being awarded at the end of the session, because most of the boards across the world try to give grades based on their yearly assessments and the teachers' recommendations, and did not actually go for an examination sort of thing or any evaluation by the board. So even those students were in a critical phase, that how will the university respond to the grades that have been awarded to them through an assessment, a report only. So yes, these were all of the issues that we discussed during our times. There were certain points of variances that we noticed within our discussion when we were discussing both Pakistan and the USA. And for one thing, I think the philosophy of education between the US and Pakistan are quite different. Like I told you earlier, the philosophy of education for US is more regarding to purposive learning or activity-based learning, focused more on critical thinking, leadership, and creative thinking. While the philosophy of education or learning in Pakistan is slightly different. It is more knowledge-based, and the learning is more subjective in nature. Because like I said earlier, we would like to develop a certain theoretical framework, a certain baseline, a certain foundation before the student actually has a chance to make professional choices. And for that, they're also exposed to different form disciplines, including science disciplines, including humanities, including arts. And they are told to make their choices, make informed choices based on those knowledge bases. So for our students in Pakistan, a major point of concern were the state schools, where the children who are attending state schools or state universities are often not they're experiencing limited resources, and connecting to technology or using technological devices or gadgets is pretty difficult for them at times. So and that is why I think the state schools initially suffered a lot as compared to the private sector schools and other education institutions, because of the availability of resources for those children. However, later the state schools also tried to come up with solutions, and the best solution that was being followed around the world and was adopted around the world was mainly dividing the whole class into smaller groups and attending schools on not daily basis, but yeah, twice a week or maybe thrice a week, just to make sure that the students come and attend and interact with the teachers. And this remained the practice in Pakistan for quite a lot of time, where Pakistan had to give due breaks whenever COVID hit hard. Currently, we're experiencing our second COVID fever. So we have just again opened schools on 1st of Feb, and other educational institutions from the 1st of February. And we're hoping and praying that our kids stay safe, and we do not have to somehow face any forms of difficulties. What interesting enough, because US and Pakistan are so different in the dynamics and so different in their learning philosophies and all. But what was interesting was there were a lot of similarities between the two nations. And I was just watching a TED talk the other day, and forgive my memory for not remembering the name of the speaker, but he said that when the world was facing different issues, the different countries in the world were facing different issues, they had different human responses to it. However, when the world was facing a similar situation, they almost had more or less similar responses to the situation, to the uncertainty, to the crisis. So interesting enough, we found more similarities in terms of how people were responding to education in both ways. So my time is running short. I have already discussed the challenges of special education and training, of managing technology, and managing the health and financial difficulties the families were facing. That was also taking a toll on the education system in Pakistan. I think just for 1 minute more, I just would like to say that we did, as a takeaway from the breakout sessions, we did realize that the policies or the education system needs to be more human-based. It needs to be more humanized, because we do realize that education has a value attached to it. It is not just about learning and gaining knowledge. It is a whole experience that would be more fruitful and more purposive if it is taken as experience. And then again, there was in times of crisis management, the only thing that works really well for everybody is the basic principle of sympathetic value, adopting sympathetic values, and adopting an empathy towards others who are suffering. So thank you so much. I think I just passed 1 more minute.
That's perfect, Tehmina. Good job.
Thank you, Witte. Thank you, Jim.
I'd like to talk a little bit now about policy implementation and the session we had on that back in July. And I think it's important to say this was back in July. You know, it seems a long time ago, and so much has happened since then. And that's one of the things that came out in that session, is a real focus on time and the course of a pandemic. We had for that session, 2 really good speakers. For all the sessions, we had good speakers, but this one, we had Dr. Kingsley Haynes, who is a university professor emeritus at George Mason, and he, along with Roger Stow, who we've mentioned a couple times today, were among the founders of what's now the Shah School of Public Policy and Government here at Mason. And then he was joined by Ambassador Tajmul Altaf, who is currently a senior research associate at the Institute of Policy Studies in Islamabad, and going back through to 1982, was a member of the Pakistani Foreign Service and served important roles in a number of countries. So each of them talked a little bit. They began describing the situation with regard to COVID-19 in each country. And again, remember, this is July 22nd, 2020. In the US at that time, there were about 3.8 million cases, 134,000 deaths. As of February 6th this year, 2021, those numbers have grown astronomically. In the United States, it's 26,851,000 cases of COVID-19 and 459,000 deaths. In Pakistan, we saw something similar yet very different. That in July in Pakistan, there were 269,000 deaths, again, compared to 3.8 million in the US, and 5,709 deaths in Pakistan at that time, as compared to what was already 134,000 deaths in the United States. And we've seen, though in Pakistan, the numbers have also grown to about just over 500,000 cases, and about 12,000 people who have died due to COVID-19. And this is one of the things I'll come back to at the end, is trying to explain what's going on here and what are the reasons that the disease, this virus, which all countries in the United States, all countries in the world are facing, how come it has taken a different trajectory in different places? And this is where more of the sort of academic social science piece comes into play. And this was introduced very nicely by Kingsley Haynes, because one of the things he has been doing is trying to model statistically the course of the pandemic, COVID-19, and beginning with the trajectory of influenza, of the flu, over time, and developed a statistical model which is based on something called the Gompertz function. I think most of you are probably familiar with the normal curve. With the Gompertz function, what happens, and in Dr. Haynes' words, the real function we found with things that have high infectious components and where we do not know a lot about the ability of the system to manage the infection, the Gompertz function, instead of declining to zero, the way a traditional S-shaped curve would, it has a fat tail, right, that it doesn't go all the way down to zero. And one of the things that when you begin to have this statistical model in mind, one of the things we want to do is look for departures from the model. Okay, in which instances does the fat tail stay further from declining to zero? And in other cases, where does it get closer to zero? And what can we think about the policies, the things that perhaps in Pakistan or in the US were or were not introduced to influence the slope of that curve? And that's a really important, I think, for several of the areas we're working in with the PPP, is to think about how over time, and another dimension that becomes very important, I'll talk about in a minute, is it's not just variation over time, but variation geographically. So between the United States and Pakistan, but also within the United States and within Pakistan, how has the course of the pandemic, where does it deviate from our expectations? And that's where we need to turn our attention, try to explain those departures, and to what degree is the variation that we find, can we account for that through policy? And I think, Kingsley also made a very good point in his presentation about the importance of data. And this gets a little bit at why we see such a large difference in the official statistics between the United States and Pakistan, is any model is only as good as the data that goes into it. And here we basically have three main components, or three types of data that are being used. First of all is case count, second is hospitalizations, and third are fatalities. With each of these, there are limitations. Case counts depends on availability and distribution and access to testing. Hospitalization depends on access to hospitals and whether or not people go to the hospital. And then death rates depend on really sort of the accounting and attribution of a fatality to COVID-19. And again, there are going to be differences between the US and Pakistan, but I think as we see the magnitude of the differences in case counts and deaths, there's something else going on there. And that's what we want to try to explore. And there again, thinking about regional variation or international variation, and to what degree is it attributable to lifestyle and living situations, to demographics, and to policy responses. Now, when Ambassador Altaf spoke, one of the things he gave a really good definition and kind of a reminder to us of what public policy is or should be. And what he said is public policy is a set of laws, actions, and behaviors adopted by a government to address public issues, provide them basic amenities of life, and look after their welfare in everyday life. For all practical purposes, if a policy is people-centric and looks after their welfare, it is a good policy. And there he called attention to a very important aspect of policy implementation and policy making in Pakistan. And that was, at its founding in 1947, Pakistan had a very strong central government that was maintained often through the support and collaboration with the military. But over time, there was and particularly beginning with the 18th Amendment in Pakistan in 2010, an effort to devolve some of the responsibility for policymaking and policy implementations down to the provincial or even municipal level. And so here, this is where we can see an important similarity with the United States, because in both countries, there are federal systems, and that there has been in many junctures, a disconnect and a failure to coordinate policy from these different levels. And so trying to figure out where we had problems, both in Pakistan and the US, in coordination of policy between different levels, that's a way to understand the impact of policy. Actually three other things that came out as similarities. One is that in both countries, despite warnings from WHO and others, and recent experience with Ebola, MERS, and SARS, we were not prepared. The basic preparation was lacking both in the United States and Pakistan. As you know, again, this was in July. As things have moved much more quickly than anticipated with the development and distribution of a vaccine, there still is a large measure of vaccine hesitancy, and that is not uniformly distributed. In some places, for example, Fairfax County, people are complaining, lining up to get their vaccination. And in other places, that's not the case. The people are really saying they don't want the vaccine if it were available. And underlying that in both countries is both misinformation and disinformation. And the distinction between those two is very important. Misinformation is, you can think of a lack of knowledge, lack of information, lack of education. Disinformation is deliberate. And that's where there are conscious efforts to mislead people, whether it's on the simple existence of COVID-19 or the value of a vaccination. Differences, one of the things, again, trying to explain why there is, for example, that the increase in cases, that the gap in cases and deaths between the United States and Pakistan, yes, some of that may be due to reporting. But what are the other factors that explain it? And that's one of the things as we move forward with the PPP, and particularly looking at policy, is to what degree can the policy responses and implementation in the two countries account for differences in case rates and how those have changed over time. And I think the last thing, and then I'm going to pass it along to Mustafa Hyder to talk a little bit about religion, is the closing remark from Ambassador Altaf, who's spoken truly like a diplomat, and that kind of level of concern and understanding. He said, we need to learn from COVID-19. A global pandemic did not receive a global response. We cannot address a pandemic such as COVID-19 from within our silos without adopting a global approach. Otherwise, we will miss the train. Let us join our minds and pursue international global cooperation. We need to evolve a holistic international global response so everyone can benefit. If we simply think us versus them, there will be a much greater calamity. And I think that's one of the things that we see as so important about projects like the PPP and the collaboration between international scholars, is that this is really treating it as a global issue. Good. Mustafa, want to talk a little bit about religion, please?
Thank you, James, Nishit, and Tehmina, for enlightening the activity that we have performed during this project time. Unlike the other themes, actually the religion theme is a bit tricky, because discussing about the religion and discussing the norms and religious norms of Pakistan, people is a bit what we can say, a bit tricky. But this discussion that we have with John Turner from United States, the faculty member from George Mason University, and Samrin Kalia from University of Karachi, faculty member of our department. They both enlightened the very right and very correct issues related to the religion and the COVID. The main objective of that discussion was how we want to understand the social role of religious scholars in the contentment of COVID, how the religious scholar can help the administration and the government to fight with this pandemic. And the other view was to study the comparative and to have a comparative analysis of orthodox versus the moderate religion-driven opinion spread by the COVID. Okay, how the religion opinion in two diversified nations have emerged after this COVID. Well, first, Samrin Kalia speaks, and she basically discussed the religious issue in Pakistan with reference to the COVID, and she stated that religion has a huge social influence in Pakistan, and that is pretty obvious. The country is democratic with a quite number of sectarian branches in Islam. Within the Islam, we have multiple branches. Owing to this influence, religion also has an immense influence on the democratic process, as well as the cultural and social aspect. And definitely that is the basic consideration that government have to consider while making any type of policy for the COVID fight. The background of this COVID and religion issues in Pakistan is that the COVID came to Pakistan, the entire country went to the lockdown. The highest body of religious leaders, that is the ulamas and the Maulvi Hazrat, announced that the public to commit with the directives of the government, and rightly at the initial phase they have do so. But there are what we can say, there are a lot of people who were a bit sentiment about this all happening. The psychological and the emotional impact was too much, and many of the people thinking that this is the end of the world and might be the day of judgment is very near, and they declined more toward religion. In spite of not going for the mosque, they try to rush to the mosque and asking forgiveness to the God. But then the highest level of ulama in Pakistan gave suggestion to the people that not go to the mosque. But again, there is a dramatical turn take place, because after few weeks, the most holy month in which the maximum religious activities were performed by the Muslim, Ramzan, was on a way. And again, it was a challenge for the government to stop people not going to the mosque. And the same case happened. There are very few incidents that also happen where people retaliate and they try to go to the mosque. And there are many areas where people actually did not go to the mosque because upon the directive of the government. But then the government and the healthcare expert and the religious ulama, the elite religious ulama of Islam in Pakistan, sit together, and this triangle basically makes some sort of compromise, and later government discuss the matter with the all these three areas. And then in the month of Ramzan, they allow people with strictly compliances the COVID SOPs to open the mosque. This was viewed by some, this is the one fact, the religious factor. But in Pakistan, the mosques are also the place of a social club for most of the poor people, because Pakistani people are not that much, most of the Pakistani people are not that much economically sound to fight this COVID and to stay at home. So there are many researchers who consider that the reopening of the mosque as the positive gesture toward the social well-being actually. Other than the religious factor, there is a social well-being factor also involved. Since for the poor in Pakistan, as I have said earlier, mosques are the social club, even facilitate them in terms of food, health, shelter. Even there are a lot of mosques and there are a lot of other religious places who were providing health care equipment, oxygen cylinders and other kits to the Nepal people free of cost. Other than that, the exceptional response, it was an exceptional response actually recorded by the religious group in facilitating the public during COVID time, in helping the government in relief by the work supporting struggling families for food, household, and all such things, as I've said earlier. As far as the United States is concerned, in United States, I got a very interesting statement from John Turner. He said, and I quote, that I think one of the things that is notable about the United States is that it is both highly religious and a highly secular country at the same time. This is very interesting for us, highly religious as well as highly secular. And he support his statement by sharing some statistics that the countrymen majority identify themselves as a Christians, almost 75% of them. Within this 75%, there are a lot of diversity exists, and the other religious group are smaller minorities, while a smaller percentage, especially younger Americans, identify themselves as not religious people. As the pandemic hit US badly, the religious group immediately complied. Unlike in Pakistan, where they have to, the government have to deliberate with the religious leader to ask people to stop going to the mosque. In US, the reaction was entirely opposite. Immediately, the people immediately complied with the government policy and took up a more responsible role, usually happen in crises such as comforting the sick, feeding the hungry, provision of roof and etc. And this is actually the similarity that in second phase of the Ramzan phase of Pakistan was there. These activities were supported by the charity driven conducted by the churches and other missionary groups. Churches and other religious activities in America, prayers were ceased in person and shift to Zoom and other online resources that could be joined from home. In US, some stories popped up. I must say, although media, there are several places where media plays a very positive role in making aware people, but as far as the other dimension of media is concerned, like thing happened in Pakistan as well as US, some stories popped up where coronavirus spread was expected due to the personalized church gathering and funeral arrangements. But the data suggests that religious procession and gathering in US were stopped, and nearly in all in-person players sessions were cancelled and conducted online. So if I talk about the similarities, implementation of similar policies by the government to manage the religious gathering was there and the prayers, and obviously people compliance these policies. This is the one of the most amazing thing as far as the Pakistani point of view is concerned. The increased civic engagement, the religious places basically increase the civic engagement by the religious leaders in facilitating the people in need, help of food, health, place, and these type of supports. Again, as I mentioned, that the media highlights few reckless religious group and not discussing enough. This is a similarity in US media and the Pakistan media that do not share the good work, and they discuss enough the responsibility and role taken up by the responsible religious leaders. While when we talk about the differences, Islamic ideology is the foundation of Islamic Republic of Pakistan. Therefore, the public decision choices and sentiments are extremely vulnerable and sensitive in terms of religious affairs. Thus, it becomes critical for even the government to negotiate some of policies to implement across the country with the Islamic scholars and leaders. On the other hand, the US government citizens consider the religion as a personal choice, and that conveniently actually participated according to the government directive, and they carry out their all the religious activities online. Most of the activities, large religious group Pakistan holds significantly political affiliation. This is a very one important finding that we had during our session, and this is obviously the difference between the religious people in Pakistan and the religious people in America. That in Pakistan, most of the religious groups, we can say, hold a significant political affiliation and influence, unlike US. Therefore, the religious narrative always have a parallel political narrative that often cause unrest, concerns among the sectarian group within the country. While in US, some of the religious activities was tried to be carried out online, such as Sunday services. Thus, these were initiative taken some how mediate the time of the panic and frustration. People get relieved, internally relieved in that time of panic and frustration. However, this practice obviously was not possible as far as Pakistan is concerned because of the technical issue and because of the way that we have religious activities. The final takeaway, which I think was from both of the speakers, and after analyzing all the things, that religion and religious leader can be an important driving agent while encountering any type of social and global change. Means religion can be one of the most instrumental tool that can be that can support the change. This is it from my side. Thank you.
Good. Thank you, Mustafa. I think, I don't know, John, are you going to sort of moderate questions and answers?
Yes, Dr. Witte. Actually, as a matter of fact, we have a number of questions that people have dropped into the chat, and I'd like to go over those if you wouldn't mind. And I think we could probably start. One question that we had was, and I thought this was quite interesting, how did the pandemic situation actually impact your research activities as part of this project?
Well, I'll speak from the US side. We've had to adapt, of course, that especially in the social sciences, there is a lot of face-to-face interaction, whether it's interviewing or focus groups, so sort of the data collection methods that we use have had to be altered a little bit. We have found in some ways that's gone pretty smoothly. That a lot of the survey research we do through my institute is already web-based. And so that did not change that much. Early in the summer, and I think Provost Ginsberg, as when we were chatting earlier, mentioned the growth in new buildings on the Mason campus. And I was asked to lead some focus groups about that development. And we did it through Zoom. And it actually worked out pretty well. And one of the things that turned out to be even a cost saving was that the Zoom audio transcripts, that was a good building block for transcribing the focus groups. It's not perfect. And we're using that with interviews as well as a way to sort of make something good out of the shift to online. And then the other thing I'll mention, and then I'd like to hear how it's changed in Pakistan. And this is for the social sciences, by the way. For my colleagues in the natural sciences, where they really need access to labs, that's a whole different matter. But for us who are in the social sciences, it hasn't been that disruptive. What has been disruptive a little bit is the informal interaction, where my lab space at the institute, we have 3 or 4 offices, and then it's set up very much like a tech startup where the graduate students are in cubicles. And then we have a conference room, but where that easy exchange of ideas and answering questions and sort of peer learning, that has been disrupted, and that's harder to emulate online. Mustafa, what's it like there in Karachi?
John, could you please come again with the question, because I lose the question.
Yes, sure. Dr. Hyder, the question was, how did the pandemic situation itself impact your ability to do research activities?
In fact, as far as Pakistani researchers are concerned, specifically again in terms of social sciences, it increased our horizon to do the research, because earlier we usually restrict with it with our small groups, and usually we do the research in isolation. But because of this pandemic, it basically widened the horizon. And to us, this pandemic, as far as this, a part of all the negativity that pandemic is spreading, this pandemic provide us the more wider horizon. And after having some sort of collaboration with GMU and other GM, am I audible?
I think if Mustafa allows me a small response, would you allow me to respond?
Gigi.
I think I would like to quote Mustafa many times, that he has come up with the suggestion that our work within the pandemic was very different this time, and rather the social scientists got a very broad spectrum to work on. There were so many new topics that we could explore, just like the themes we discussed here. And when we were actually working on these 8 themes, we came up a few more themes, and somehow we were able to connect in very different ways. I think not just the US, when we were doing these themes, we connected not just with US, but we also had a German friend with us who attended a lot of sessions, and her perspective towards a lot of our themes was very different as compared to us or maybe the US participants. I think overall, many research opportunities were created during the pandemic for the researchers overall. However, there were certain research restrictions also, especially in areas where we had to interact and collect data. And where we had to collect data from people who are not really familiar with technology. Most of them were marginalized communities that were not very familiar with technology. But otherwise, technology was a lifesaver for us at this very testing time. And I believe it was both ways. I would say some was restricted, some restrictions we did face, but overall it was a very nice time and opportunity, held a lot of opportunities for researchers in this time. Thank you.
Dr. Faisal, I actually have a follow-up question that I'm going to direct to you because it's about education. The question is, coronavirus has rammed home the extent of Pakistan's digital divide. Could it lead to a useful debate about the future of technology in education?
The future of technology in education is pretty much apparent. I think we all realize and we all have come to the conclusion that technology cannot be avoided. It's not just education, but it's all fields. I think when we were talking about religion, and John Turner told us a story about how the Christian churches are somehow reaching out to people through technology, conducting mass gatherings through technology, conducting congregational prayers through technology. So if a very sensitive thing like religion, where people need to connect to the religious scholars, or they really want to connect in one way or the other, can be conducted through technology. This was one very good example for us that all of the things or anything can be achieved using technology is an effective tool. Typically for education, I think we're still struggling with the impact of how effective technology can be. And it's still an experimental phase, but we do realize, and we are sitting in a webinar right now, that technology can be really helpful in connecting and networking, and somehow it would create a platform for creating a better and more responsive audiences at times. So for me, particularly, if my opinion is taken as to the digital era and how technology can be effective for educational purposes, I think it is a foregone conclusion that it is there and it will help us out in a lot of ways. I'm just waiting for more apps to come over and somehow, digitalize the whole deal. Thank you.
Thank you, Dr. Faisal. I have a question that I'd like to direct to Dr. Hyder, please. And this is, the question is it high time to introduce a uniform set of guidelines to be communicated throughout all the, throughout all the religious bodies, whether that be mosques, churches, temples to adapt to the new normal in regard to acceptance of vaccines and integration of sympathetic community support systems for prompt rehabilitation of those highly affected by COVID-19?
Yes, indeed, it is a high time, but it's a very difficult task because see, religion is something is very close to the people, and religion is in which usually people get people have a close sentiments with the religion. So it's a bit difficult to have some standardized policies and procedure for all the variations of religion. If we talk about the Islam, in Islam we have different sects, and we are unable to have a uniform guideline among those set a part of the basic guidelines. So I don't think so. Okay, it is an easy task. It is a high time although, but it's not the easy task to do it. So I think it's a bit difficult to have some sort of international globalized standards or some sort of globalized line which all the religions can follow.
Thank you,
May I
Dr.
also comment?
Mm-hmm. Sure.
The thing is that for religion also, as Mustafa pointed out, it is also very difficult. However, keeping the nature of the crisis in mind and the kind of pandemic that we're facing, with almost everyone's facing similar situation, certain policies have been adopted by almost all the religious institutions. The policy, the SOPs that they're following of the standard policy, ensuring hygiene, ensuring distance, social distance, ensuring regular cleaning of the whole place. So there are certain policies, yes, that can be globally implemented. But yes, just like Mustafa said, there are a lot of other policies that cannot be globally implemented owing to the nature of the religious sentiment and the religious practices that are followed. Thank you.
Yeah, and I think that's also, it gets back to a point that Mustafa raised in his presentation from Sumran, is that there is this social function of religion that can be seen in some places as distinct from the theological side and the systems of belief. And so to the extent that you can focus on the social aspect of religion, and because as John Turner said, in the US, that's very clearly distinguished, the social and communal aspects of religion from the belief system, that there you can sort of address issues like COVID-19 on the secular aspect of religion without touching the theological side. And I think there, as Mustafa pointed out, it's a much more unified religious system in Pakistan and throughout Islam. And that makes it a little more difficult to not tread in deep water, let's put it that way.
Thank you.
I would like to say, Jim, just a point about what the Mark asked about the religion, and the Mustafa said that it is he's saying that it is really a tough task. I can understand it is tough task, but I think it is doable, because no matter which religion and which sect within the religion, idea is to have a healthy life, and this COVID is something, it is a medical issue. So through the various representative of the various sects of the different religion, we as a policy, if we are the policy makers, we should try to reach them and ask them to come to a common ground that will help them, that will educate them. This is nothing to do with other parts of religion. This is either life or livelihood, and that will make the task for the vaccination across the board easy. This is my point.
Thank you. So maybe I have another question, and it could go to any of our panelists, but maybe we'll stay with you, Nishit. The question is, like two sides of a coin, could we also expect any positive outcomes coming from the pandemic?
I would say, I always see this is, world is moving from democracy to meritocracy. And this pandemic has really opened the way for the people to see advantages of going from a blind democracy to where you have a meritocracy. So this has really united the whole world. So there is a common ground. Can
Actually,
you
I
put the
also
question in a slightly
I would
different way?
like to comment. Mustafa, go ahead.
Okay. Okay. I would talk about Pakistan. In Pakistan, the women empowerment and equality for the women is a big issue, and having everything is online because of this COVID. I think this dream can be achievable now because there are a lot of women, a lot of females who cannot commute, who cannot go to the workplace. Now they can work from home, and we are witnessing there are a lot of success stories after this COVID. That there are a lot of people who there are a lot of women, in fact, who are actually working from home, and they are after this COVID earning a very good salary. Like there is a project, I guess it's Sehat Kahani. Tehmina would be in a better position to tell about it. It includes the female who cannot, the female who cannot commute, who cannot go to the job because of they are female doctors who cannot commute and who cannot go to their jobs because of the family commitment. Now they sit online on a certain time slot and they give consultation to the people, to the other patients. Similarly, there are a lot of household ladies who are very good cook, and because the all hotels and other type of outdoor eatable resorts are closed, their business was flourished, and they are doing very good in this COVID regime. So I think there are positive aspects of other than the health hazards and the economy that the COVID demolished. There are a lot of positive issues that positive aspect that COVID have generated.
I think,
Tehmina.
I think I would agree with Mustafa. The online marketing end was very hyped up in Pakistan. I think the people who was could not earn by going to the markets and everything, and how the markets were closed. The online business and marketing and the shopping line was one huge sigh of relief, even for me. I just could sit home and go for online shopping, all kinds of food and clothing and everything. And then again, I would also like to add that there were 2 or 3 things that I exceptionally noticed. One was the research opportunities that were provided to us and that we could foresee for all of us, for all academicians and researchers. One more aspect that I genuinely felt and really felt good about was the kind of empathy and sympathy that was shown throughout the globe regarding people who are suffering or towards marginalized communities, and somehow somehow our nature of standing on a war footing all the time and just struggling and competitive and somehow trying to achieve each and everything, it just took a small break and gave us a breathing space, and somehow we were able to connect and see other people, other communities around us who were struggling, and we wanted to help somehow. That was a very inshallah, if we do have the second session also, we will be discussing family and mental health issues and everything. And in that session we discussed a lot about of how this thing has turned into an opportunity or a threat to certain people in the society. So I felt the kind of empathy and sympathy that people were exhibiting towards each other within their communities was phenomenal. I mean, I would have to talk about Pakistan. It was just very exceptional. It actually made all of us really proud when we discussed it within our meeting also. One more thing that I came across was and we were working on a project, Mustafa was also there, regarding the human resource practices in organizational settings. And we observed that the human resource management in organizations, they took up a really amazing turn. And they tried to reach out to their employees in ways that were different than the conventional ways. And they were more protective of the employees. They were very protective of their jobs. Somehow they wanted the employees to state that they had job security, they were safe. And also they adopted a more innovative and style of management, which we had studied, not very relevant to this session, but yeah, it was there. So yes, it had in some ways it did have a positive impact. Thank you.
Yeah, I would agree with you, Tehmina, and on a couple points. First of all, as you noted, that a lot of the similarities that came out in our discussions, they were really at the individual level. Okay, that this is where sort of common humanity came out, and people recognized in one another. In our breakout rooms, for example, the sort of the challenges faced, regardless of whether an individual was in the United States or in Pakistan. I think where we see the differences is again at the social level. the sort of organization of institutions and culture, and sort of working through these organizations that sometimes, and cultures sometimes, masks the individual similarity, and the sort of common humanity gets hidden by these social and cultural structures. And I think that's one of the opportunities now, is revealing that and sort of making it apparent to people. And I think this touches also on one of the other questions I saw in the Q&A chat box. Is one of the other opportunities is really for the micro, small, and medium-sized businesses. That there's Mark Ginsberg had this nice opening to his presentation this summer, where he talked about there's disruption, there's adaptation, and then there's acceleration. And so we've seen this adaptation happening. We know it's going to accelerate. It's going to play itself out through all of these institutional areas that we've been looking at. And now the issue is, how do we manage that acceleration and turn it into a positive process rather than a negative? So that we know, if you look at the United States, and I'm sure in Pakistan as well, the impact of COVID-19 on small businesses has been catastrophic. Whether it's a small restaurant, whether it is small contractors, different cleaning services, their work has really been upended. And it's going to continue to do that way. Nishit and I were speaking yesterday about office space. Okay, so the immediate thing you'll read in the New York Times is all of the landlords who are going to be losing money. And as people may not return to New York or to Karachi. But what about the people who clean those offices? What about the people who ran the restaurants that served lunch to the office workers? All right, so how do we figure out new economic opportunities that are going to be, not only that was adaptation, but now this is going to accelerate? And so how can there be mechanisms, and this is where I think policy can have a real positive impact, is how do we help people go through this next phase? That the disruptions happened, and now as we're moving to the other side, what are the policies that can address that?
John, I would like to say to you that you, being a career diplomat, and you have just been to Pakistan, and you said that you were there for 18 months and so, I think the takeaway from this PPP 1 and going to be the 2 is you can take a very good lesson as in your public diplomacy discourse to the people in Pakistan, or to the Pakistani, that here, I'm not a big brother. That is what is referred to the Americans. Here we are someone who are equal. We are same. When we had this problem, both the countries dealt equally and similarly. So this is a good lesson for the public in the public diplomacy discourses for a diplomat like you, I would say.
I agree, definitely. It's been a great introduction, since I've only just been here a little while, to see this project and hear all about the findings that you've discovered during your research. Thank you. I would like to ask, there have been a few questions about the effect of disinformation, and I believe that you're also going to be speaking about media, so I don't want to get ahead of us, but I was wondering if you would like to address that tonight, any of the panelists, the effect of disinformation in the areas that you've studied and spoke about tonight.
Yeah, I'll take a first stab at it. And again, as I said earlier, this distinction between misinformation and disinformation is very important, because how we address them is different. Misinformation, we can think about how do we better educate people? How do we provide accurate information? And I think there are two things there that are important. Is it's not just the message, it's also the messenger. So who is speaking and sort of providing a message about the importance of vaccination, for example, or about the real health risks, about the significance of these basic measures like social distancing and mask wearing? Who is spreading the word? And one thing we had too many topics. to actually move into phase 2. But one of the interesting ideas that came up in a discussion with one of the graduate students was the idea of science heroes. So who are these people who, most obviously Dr. Fauci, who come out and sort of really give a message and is believable and has authenticity. And that's very different than some of the other messages that were given by people you might think about as sort of science anti-heroes. And I think that's, to me, one of the real bright spots, particularly as an academic, when you look at the transition to the Biden administration, that the importance of science is really being elevated. That there now is a cabinet level position for a science advisor. And I think that's really going to change the game in terms of the quality of the message. And then also thinking about these messengers, not just the heroes, the Dr. Fauci type heroes, but also daily heroes. Who are the people in particular communities? I've seen a really great example that the Mayo Clinic was doing to talk about therapeutic plasma. And trying to get people to donate. And they started a social media campaign called The Fight Is In Us, and had Samuel L. Jackson give a public service announcement. They had The Rock do a 30-second public service announcement, all in ways to sort of speak about the significance of this to a different audience. And then in some of the work we're doing on food insecurity, in sort of marginalized communities, the messenger who's so important is, the auntie, who everyone knows in the community, who can get out and say, here's where you can get services. And by the way, here's a mask, you should be wearing it. So I think the misinformation part in some ways requires better information, better messages and messengers. But then the disinformation part, that's really where it's going to take sort of conscious effort and sort of, counter information and, really, and I think, the government does it. There's some groups, the groups that were working with the Mayo Clinic on this one campaign. The MITRE Corporation has a group of data science people that are really trying to uncover deliberate attempts to mislead. And figure out who are the bad actors that are going into a space and promoting disinformation to mislead people. So I think making that distinction is important because the countermeasures are very different.
Thank you.
I also want to have a quick comment. One of us definitely going to discuss media in detail in the 2nd March session, but I just want to share one thing. I guess 2 or 3 weeks before the parallel pandemic project 1 started, me and my family got with this virus, and what my doctor advised: number 1, don't go to hospital. Number 2, log out your Facebook and don't see the TV. You would be okay. And I did the same, and we all were recovered. See, the impact of this information is immense. This COVID is all about your nerves, and this information usually carry on the nerve, and that's why there are a lot of people who lose their life because of these non-serious and this what we can say non-serious or uncontrolled media uses.
Thank you, Dr. Hyder. Dr. Witte, I'd like to come back to you with a bit of a follow-up question. You spoke about the new administration in terms of messaging. I'm curious if you would, and there's a question in the chat box about this, about what you would see as the effects of new policies coming from the new administration.
I think, there really is sort of a sober realism that, the Biden administration has adopted, and I think it's going to serve them well. And kind of stepping away from the noise. All right, let's think about how we address, concretely address the issues. The fact that, President Biden swore in, 1,000 federal employees on the night of the inauguration, and really sort of said, it's the way we're going to get ourselves out of this mess is kind of rolling up our sleeves and saying, okay, this is what needs to be done. And I don't think we should take away from the previous administration, the efforts they made to develop vaccines and to really sort of put together teams through this Operation Warp Speed, and that has made the vaccine available. But now it's getting it into people's arms, and that part of the plan was lacking. And I think they have recognized with the new administration that's an immediate step. And I think also they're speaking very openly about it's not just getting a vaccine. That there's going to be, we have to continue to maintain social distance, that we have to continue to wear masks, and that this is not a silver bullet. But then I think it's going to be in part a sort of comprehensive approach, which is something we've seen with the PPPs. COVID-19 is not just a health issue. That there are economic consequences, social consequences, and I think those have to be given priority as well. And I think that's going to be an important measure of the success of the new administration, that they're able to balance, keep many balls in the air at the same time.
Well, thank you so much, Dr. Witte, and thank you to all of our panelists. I think that brings us just about to the end of our program. But before we go, I wanted to invite you, Dr. Witte, maybe to say a few final words before we go.
Sure. Well, I appreciate that we had a nice group here, some good questions. I really do think as I mentioned earlier, in addition to what we're learning about COVID-19 and what we're trying to do as we move into the next phase is to think what are the lessons learned for future crises, future questions where we're going to have to address these globally, and how we cooperate together to do that, and whether it's through formal diplomacy or informal diplomacy, people-to-people diplomacy. And also, I think our experience in the PPP and in the university partnerships beforehand has been that the academic community is an important partner in this process. That by very definition, science does not know borders. That it's supposed to be a group venture. And regardless of where you are, you benefit from that knowledge. And I think that's one last point that I think, here at the Institute for Immigration Research, we really have been identifying and talking about for a long time is immigration policies that limit the free flow of idea and the free flow of scientists. That's going to hurt us all. That we really have to, we do an annual series on the Nobel Prize winners and on lead scientists. And, that's sort of doing science above the rim, to use a basketball analogy. That happens internationally. And we really have to do everything we can to foster that.
Thank you, Dr. Witte. I'd also like to invite our other panelists. Perhaps Dr. Hyder, would you like to say a few words before we go?
Yes, I guess this is the strength of this partnership, that the project was just a informal attempt between me and Dr. Witte to address our students. But as soon as the US consulate take it over, it becomes a brand, and this shows how the ownership basically works. And it was just a regular attempt, our regular lectures, and then when you guys take it over, now they are more significant. And what I personally believe, that sharing the lived experiences and sharing the issues, having very diversified culture and economical and other norms, it is basically the most positive thing that we are actually gaining. We and our students are gaining. Actually, our students are gaining a lot from our US counterpart, and obviously it would be vice versa. But this is the power of partnership, and this is the power of ownership that you guys have given to us. And I guess we, on the behalf of University of Karachi, are very thankful to the George Mason University, Provost Ginsberg, Nishit, and James for providing us this platform, and obviously to the consulate, US Consulate of Pakistan, for owning this attempt and making this attempt a brand. Thank you.
Thank you, Dr. Hyder. Would Dr. Faisal or Nishit Sahay, would you'd like to say any final words before we go?
I think if I can take the platform first, this particular project, like I said earlier, has been very close to our heart. Yes, that was one very evident. I think it was pretty evident today. But apart from that, also I believe that what we came to a conclusion at the end of those sessions was the need to prioritize and understand the need and wants and demands of the public, and actually understand what comes first, what comes second, and what comes third, and go one by one to address a lot of issues that have emerged as because of the COVID. And at that, I think I would like to say hi to Dr. Susan. I saw that she's here. And she was a lovely person to listen to. I always enjoyed her time with me during the breakout session. I always looked forward that she will be around in one of my groups. And she just suggested that how these things can be prioritized and how we can somehow connect at various levels by breaking the whole activity into smaller activities and focusing on each and every bit, rather than somehow going for a very comprehensive, full-on approach all at once. And this is what I learned from this was my takeaway from this particular session of Parallel Pandemic Project Phase 1.
Thank you so much. Nishit, would you like to say anything before we go? I think he might be frozen. All right, well, I will then say thank you to our panelists. We appreciated this very much. It was very informative. I think we all learned a lot tonight. Thank you so much. We are going to look forward to the next session, which will take place in about a month, and which will cover different aspects of the Parallel Pandemic Project. Before we go, I wanted to mention, I saw one question about whether the findings of the project would be archived, and I believe I do know the answer to that. The PPP will be producing a website, has produced a website, I understand, at parallelpandemicproject.com, in which they will archive their findings and plans to expand to possibly other countries. So you can look for those findings there.
John, I just put it in the chat box, and I think for people that what might be really interesting is we videotape all the presentations, and so people can go there and see the original speakers.
Thank you, Dr. Witte. So with that, just once more, thank you again, and look for our next session, which will be taking place in early March. Thank you, everybody. Have a good night.